We even had the governor of Ohio now saying that his state is on the road back. How encouraging are the latest numbers?
Well, there's no question that the latest numbers are quite encouraging in terms of particularly cases and hospitalizations. I mean, the number of cases are basically, daily cases are basically half what they were a month ago. Hospitalizations similar. Deaths, which, are considered a lagging indicator, are still remain high. I mean, if you take New York, for example, during the summer it was regular to have 5, 10, 15 deaths. It's regularly now, about 100, 150, 160 a day. So, no, the change is real. The question is, the sort of race between the variants and the vaccine.
In a more respected study says this more transmissible coronavirus variant is likely to become the dominant strain in the U.S. by March. So is that going to reverse some of the improvements we've seen?
Well, it certainly could. It is more transmissible. That means more cases. That means more people in the hospital. It's not necessarily more deadly itself, but the question is, can you get enough vaccine out there to provide some immunity to the UK virus? And the vaccines that are on the market right now are in fact effective against the UK variant. And so that's, like I said, that's the real question. There's a bit of a race between the spread of the variant and the ability of vaccines to do their work, and of course for public health officials and politicians to keep up with the messaging of masking, social distancing, other measures to control the virus.
And it seems we're getting a little bit more information on which vaccines are effective for which variants. AstraZeneca doesn't seem to be as effective for the South African variant as its counterpart in Johnson & Johnson.
Correct. Well, all of the vaccines show some reduced efficacy against the variant that sprung up in South Africa to begin with. But AstraZeneca seems to have, to be especially low. In fact, to the point that South Africa suspended today using AstraZeneca, saying that it would go with Johnson & Johnson and other ones that show a little bit more efficacy. All of them, AstraZeneca says that it's, aware of this and that it's been working on I guess the word would be a booster or a supplemental vaccine that will be available by the autumn. But the numbers are a little bit shaky. The studies were quite small. Still, everyone agrees that the vaccines aren't as good on the South African variant. And remember, we have seen it crop up in 3 states in the U.S. so far.